Unbelievable, a nation confronts fear and stigma. The hospital corridors were unusually silent that morning. Nurses whispered. Doctors avoided eye contact. Rumors had spread faster than facts, and fear had entered the building before sunrise. Nkonyane, a respected public figure and mother of two, had been admitted days earlier after complications related to a chronic illness. Her condition required close monitoring, but it was stable. What was unstable, however, was the atmosphere around her. Someone leaked information about her diagnosis. Exploded. Speculation turned into accusation. Ignorance disguised itself as concern. Commentators who had no medical training began spreading fear. Is the hospital safe? Some asked. What about the other patients? Others posted. Inside the hospital boardroom, administrators felt pressure mounting. Phones rang without pause. Families of other patients demanded reassurance. Politicians called for statements. Instead of standing firmly on medical facts, some decision-makers faltered. That afternoon, Monica was called into a quiet office. The words that followed would ignite national outrage. Due to public pressure and safety concerns, we believe it is best if you continue treatment elsewhere. She stared at them, stunned. Safety concerns, she asked calmly. For whom? No one answered directly. The truth was simple but uncomfortable. Fear had overpowered science. Misunderstanding had overshadowed compassion. When news broke that Monica had been asked to leave the hospital, the country reacted instantly. Medical associations released statements condemning discrimination. Doctors appeared on television explaining clearly, her condition posed no risk to others in a properly managed medical environment. Advocacy groups called it a dangerous precedent. Religious leaders urged compassion. Within 24 hours, protests formed outside the hospital gates. The story had shifted. What was once whispered in corridors was now shouted in public squares. Young medical students organized teach-ins about disease transmission. Nurses shared emotional testimonies about treating patients without prejudice. Survivors of similar discrimination came forward with their own painful stories. The nation was no longer debating one woman's diagnosis, it was confronting its own fear. Under mounting pressure, the hospital board called an emergency meeting. Experts were consulted. Policies were reviewed. Legal teams warned of serious consequences. 3 days later, a public apology was issued. The hospital acknowledged that its decision had been influenced by public panic rather than medical evidence. They pledged mandatory anti-discrimination training and invited Monica to return under full protection and dignity. But Monica surprised everyone. Standing before cameras, composed yet visibly emotional, she spoke not with anger, but with clarity. This is not about me, she said. It is about every patient who has ever felt ashamed for being sick. Illness is not a crime. Ignorance is. Her words echoed across the country. What began as an act rooted in fear became a national awakening. Schools introduced better health education. Community leaders organized awareness campaigns. Healthcare institutions strengthened non-discrimination policies.